All right, so today we are still continuing with some lower limb exercises for you. This is not very traditional, normally you'd have the foot bar in the opposite direction. It's bottom loaded. I've just got one short spring on here. So when the foot bar is the other way, where you normally do your footwork, then last week we talked about a quad activation exercise. So scroll around on the site to find that exercise. Now with the bar at the opposite end, we're going to get better hamstring connection. Important to get co-contraction of the hamstrings and the quads for lower limb pathology. So Matt, make sure your little toe is on the bar. Yeah. What I'm looking at is Matt's tail is right at the very end of the bed. It gives you a little bit of spinal distraction as well, so you can feel a little bit of space in the bones of your spine. Start at around about a tabletop shape and then push your legs up to the ceiling. And as you bend your knees, you're going to feel that you're dragging the bar down with your hamstrings. Hold it there for 3, 2, 1, push away for 3, 2, 1, bend your knees for 3, 2, 1, hold it there, 3, 2, 1, push on up, 3, 2, 1, bend your knees, 3, 2, 1, hold it there. Now let's go into single leg. So you can pop your inside leg down towards the floor. There you go. Yeah, is that okay for you? You can let it hang, that's fine. Is that hanging for you?
Yep.
Wow. So some people, obviously this is tight through Matt's leg, right? So this is a good portion of the exercise for him to allow for that psoas and those quads to release while he focuses on some single leg work. Exactly the same again. Press on up, 3, 2, 1. Bend your knee, 3, 2, 1. Hold it steady for 3, 2, 1. So let's go again. I'm going to talk you through this. You're extending, muscles are working in one direction. You're bending, muscles are working in the other direction. You're holding it still, muscles are working in a static connection. Really important to get all of those connections. Let's do 2 more. Push away. Full extension of the leg, bend the knee, flexion into about a 90-90, hold it there, 3, 2, 1. Now push on up. So let's say you've done about 10 of each one. So Matt, I want you to hold the bar there. At the same time, I'm going to pop my hand onto the bone of his pelvis, his ASIS, and I'm going to stretch out through to the top of the knee. That's going to give him a nice little stretch through the front of the leg. Good. You press up into my hand and then let it go. Beautiful. One more time, press up into my hand and then let it go. So I'm stabilizing through his pelvis while I'm pulling down or pushing down through his knee. Let's swap on over sides. And you can let the other side go. There you go. So then you're going to continue on the other side, right? So pushing up for 3, pulling down for 3, and then holding for 3. Remembering that this is a great way to activate hamstring in lower limb pathology. I'm particularly working on the knee. So keep following these exercises. I've got a couple more coming to you in the next week. Great, thanks for following us.